Ready.
A warm welcome to all the PhysioTV viewers. I am Dr. Farheen Patel, and I welcome you all to another amazing session on the Caregiver's Guidebook, A Mental Health Perspective by Shivani Mandrekar. Dr. Shivani is a UG University merit holder from Sancheti Institute College of Physiotherapy. She is Master's in Manual Therapy from Manipal University. She is also a psychological first aid, John Hopkins School of Public Health, USA. She has successfully authored 3 international PubMed publications. She is also the founder of Love's Labor One. She is the member of Advisory Committee, Mental Health Committee of Sancheti Institute College of Physiotherapy. It's a pleasure to have you, ma'am. I want to hand over the session to you.
Hello. Hi, Dr. Sareen. Thank you so much for having me. It's always a pleasure to be back at Sancheti and be a part of all these wonderful initiatives. I don't think I can think of any college who is taking so many efforts for the mental health of their students. So it always makes me proud to be a part of such an association. So thank you. And thank you to everyone who's joining in today. The sheer fact that we have people tuning in on a Sunday afternoon for a talk on mental health makes me super happy. I mean, it just shows how far we have progressed in this journey of mental health awareness and mental health care. So yeah, thank you everyone. Thank you for coming in. Now, we have all gathered here because we all share a common interest and a common concern. And that is helping a loved one with a mental health illness get the right care that will bring about a difference not only in their lives, but also in the lives of their families. Now, the reason I say that we all share a common concern is because I am one such mental health warrior. Now, I was diagnosed with a generalized anxiety disorder around 6 years back, and with ADHD, that is attention deficit hyperexcitability disorder, around a year back. Now, within these 6 years, I have seen a parent suffer from caregiver burnout, another parent suffer from caregiver depression. I have had a partner suffer from caregiver burnout, leading to a life-altering breakup. I have seen a friend suffer from compassion burnout, leading to the devastating end of a lifelong friendship, and have seen multiple strained relationships throughout my own life. And all of this because neither me nor my caregivers at that time knew exactly what was happening or what could be done. Now, don't worry, all of these stories have a happy ending, except one maybe. But that is exactly what I'm here to share today. That yes, I do know the massive impact that a mental health issue can have on a person and can have on their loved ones. And yes, I have had a first-hand experience with them. But with the right guidance, with the right help, with the right direction, it is possible to happily coexist in a way wherein the care and need of both the mental health warrior and the caregiver are met and are fulfilled. They're looked after. And today we'll try to touch upon a few of these areas and how we can incorporate them within our own lives. However, before I do proceed further, I would like to establish that I am not a professional. I am not trained in any forms of psychotherapy. So whatever I do share here today, I'm drawing purely out of experiences from my personal life, sharing lessons that I and my loved ones have learned and picked up along the way, and is in no way a substitution for therapy. The whole purpose of sharing on this platform is so that you may be able to relate to something from my life, or I may be able to impart you with some hope in the darkness right now, or I may be able to give you a push in the right direction. Either way, this is not a substitution for therapy, and it is only a sharing of experiences. So now that we have that cleared, let's begin. So has anyone ever heard of Rosalind Carter? So for those of you who haven't, Rosalind Carter was the former First Lady of the United States of America, and she was a leading mental health advocate for most of her life. One summer morning, when she was campaigning in rural Georgia for her husband, she came across this exhausted mother who, after a very tiring night shift at the factory, was heading home to look after her daughter, who was suffering from a serious mental health illness. Now, looking at the plight of this mother and many such caregivers later on in her life, affected Mrs. Carter deeply. And she went on to form the Rosalind Carter Institute for Caregivers, which till date provides support and runs programs for caregivers throughout US. There's this beautiful quote which you can see right now, which was given by Mrs. Carter, which is a very fitting start for our talk today. So she said that there are only four kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers in the future, and those who need a caregiver. So if you look at it, doesn't that cover almost all of our population? And it just goes on to show how important it is that we shift our focus every now and then, if not have an equal focus on our beautiful, wonderful caregivers. And today's talk, as is clear from the title, is catered to these very caregivers. So today we focus on parents, siblings, partners, roommates, flatmates, and even neighbors who, as caregivers, decided to stay when everyone else chose to leave. Those who shouldered us on the darkest of nights. Those who show that words like love, empathy, compassion, humanity can never really be explained by the dictionary. And those whose own call for help often goes unheard. So hopefully I'm able to provide some clarity to all you lovely caregivers today, some clarity in all of this chaos. And hopefully I'm able to remind you that you are not alone. Often caregivers tend to describe themselves as just a mother, just a father, just a daughter, or just a partner. However, if you have, or if you do provide support to anyone with respect to running errands, cleaning, cooking, any form of emotional support, then you are a caregiver. You are valued and you deserve to be seen and supported and taken care of. And today's talk is for you. So, over the years, as I've spoken to friends, family, and as I've tried to understand what are the queries that they have with respect to supporting me and my mental health, the queries usually fell into these three broad categories. Usually they said that, how do we know that a loved one is going through something? How do we know when to help? Like, what do we do to help? And when do we seek professional treatment? So usually the queries do fall into these three broad categories. However, if you or your caregivers have ever faced any other difficulties, have had any other queries, then do put them in the chat box below. If time permits, and we can always try to answer them at the end of the session. But I will go into all of these in detail right now. So number one, okay, how do we know that a loved one is going through something? What are the telltale signs of a mental health issue? Now, whenever I have spoken in the past, whenever I have tried to create awareness about mental health in the past, I have realized that I focused a lot upon clarifying the signs and symptoms of different mental health illnesses. So I would often say, this is what anxiety feels like, or that is what someone with depression would look like, would present like, or if someone does this, it means that they have ADHD, and so on. However, like we established in the beginning, we are not professionals, and uh, making any form of diagnosis, even if it is a provisional diagnosis, it would be grossly incorrect and it would also be unfair to the person. And so, making such a diagnosis would not be the right way to go ahead. Now, you would say, then what do we do? Like, if we do not know the problem, how do we find a solution? How do we know if someone needs psychiatric or needs psychological assistance? So, for starters, we can change the way in which we are asking our questions. So instead of saying, or instead of asking, does my daughter have anxiety? Or instead of asking, is my colleague going through depression? Or the more or uh, the more commonly used one these days, does my roommate have an OCD? So instead of asking questions like these, we could ask, does my daughter have a mental health illness? Or does my colleague have a mental health illness? Or does my roommate have a mental health illness? Now, you might say that, Shivani, isn't that the same thing? Like, aren't we back to square one? But no, my lovely caregivers, we aren't. Because this time we are focused on answering a simple yes and no question. So this time we're only asking, does our loved one have a mental health illness? Yes or no? This time we're not putting them into any category, something that we might not be able to do accurately, and something that we should kind of steer clear from. And we will still be able to help. So now, how do we identify that? How do we know if they have a mental health illness? Now, there are two telltale signs. Okay. There are two hallmarks of a mental health illness. We need to look out for symptoms and we need to look out for time. Within symptoms, we need to look out for changes in mood, changes in thinking, and changes in behavior. Now, when my mental health issue surfaced for the first time, I would remain quiet all the time, or my roommate would often find me crying at least once a day, or my mother would point out that I was snapping at my younger sibling on the smallest of things. So all of these represented changes with my mood. I would often verbalize to my mother that I don't know if I'm going to pass an exam, and I would go on to become the university topper. Or I would repeatedly ask my partner that I don't think I'm good enough for you. And why are you still here? Why are you still staying with me when I've got all of these flaws? Even though he would repeatedly tell me that what I see as flaws, he doesn't. All of these showed changes with my thinking. Changes in my behavior started showing up in terms of significant changes in my sleeping and my eating habits. So on some days, I barely slept. I was a light sleeper. And on other days, I slept throughout the night, even throughout the day. I would indulge in food. I would overeat, and that would give me comfort. And on other days, I just couldn't get out of bed, not even to eat. So these were the changes in behavior which were going from one extreme to the other. However, for loved ones to consider all of these changes to be significant, they need to consider the second hallmark of a mental illness, which is time. So these signs need to persist. It is not a matter of a few days, but they need to persist for weeks or months for them to be significant. And they do not get better on their own. So there you have it. If you look out for symptoms, you look out for time. You look out for changes in mood, changes in thinking, changes in behavior, and you look out if all of these changes persist in order to identify if your loved one might be going through a mental health issue. Okay. However, would okay, I would like to make a point here that uh, sometimes you don't need to know if there's an underlying mental health issue. Sometimes you don't have to wait for weeks or months in order to confirm what you are seeing and only then help. Sometimes it is important to respond sensitively to someone who seems to be troubled at that moment rather than waiting to see whether the person has a diagnosis or not and only then intervene. So yes, time for sure will tell you confirmatively what is it that we need to do ahead. But till then, it doesn't take too much to ask someone if they're doing okay. It doesn't take much to let someone know that you're there for them if they need you. It doesn't take much to sit down with someone and listen to them with empathy and kindness. It doesn't take much to be a mental health ally. So on that note, we are going to move on, if my system allows me, on to our second query as what is that you can do to truly help? How do you establish yourself as a mental health ally? How do you ensure that you are approachable to others so that they can come and speak to you? Okay, so for starters, I want you all to give yourself a nice pat on the back because just by being here today, just by trying to understand the do's and don'ts of this huge world of mental health, you have taken your first very important step of educating yourself. Well done. Kudos to all of you. But do not stop just here. Today we've got access to so many resources. So even after this, go ahead and look at more YouTube videos, listen to podcasts, follow pages on social media, follow people on social media, and listen to more and more stories that people have to share, and keep expanding this knowledge of yours of the mental health world. But that is my first step in how can you help someone. The first thing is by beginning to educate yourself. Okay. We move on to tip number 2. Promote yourself as a mental health ally. Now, this is the most, I would say, the most common query that I have been asked ever by caregivers as to how do I make someone believe that this is a safe space to talk to? How do I make myself more approachable? How do I make my loved ones know that I am truly there for them when they need me? Now, I like to put it into 3 categories. I believe these are 3 ways in which you can promote yourself as a mental health ally. Share your story, get involved, and check in. So, number 1, share your story. Okay, so share your story. Sharing your story is exactly what I'm doing here today, right now. We can talk about statistics and estimates and percentages for hours on end. And they are all indeed very important pieces of evidences. But nothing is as powerful as someone's personal story. Sharing your lived experiences, whether it is with a serious mental health illness or sharing your experiences of living daily with anxiety, can be very powerful because it allows someone to see themselves within your story. It allows them to feel less alone. And it opens the door for them to speak to you. You now start becoming a visible and an accessible mental health ally to them. So that, I believe, is the first step to establish yourself as a mental health ally. Share your story. Tip number 2, get involved. Now, mental health is everyone's concern. And so you can get involved at multiple different levels. Start having conversations at home. Our parents, mine at least, come from a time wherein mental health was not really spoken about that much. And the awareness for mental health was almost close to nil. So I have had the most invigorating conversations with my parents, wherein I try to understand why they think a particular way or where their ideas come from. And they get to learn from me about how the world has changed or what can they do better now to support people in this world. And this way we both learn and we grow together. So it can be really amazing. You might have some great conversations with your family. In fact, the other day, I and my family, we were talking about pronouns. And I was telling them that how not considering someone's pronouns can be so mentally distressing and can be so disrespectful for them. And at the end of it, they learned about pronouns. And I learned about patience. But just apart, start having all these conversations, conversations at home, conversations at your workplace, conversations with neighbors. You can talk about how mental health is portrayed in pop culture, in movies. You can talk about how that portrayal in movies, how was it truly relatable to what happens in real life. Uh, you can talk about sharing experiences amongst your colleagues. You can start opening up safe spaces, or you can have discussions of how you can make your work a safer place for people to open up and talk more. Try to participate and support reforms at your workplace. If there are reforms wherein changes are being brought about mental health leaves. So try supporting such reforms, share posts on social media. Again, doing all of these things is going to make you a visible and an accessible ally for those around you. You will now be viewed as a person who someone can approach either in time of need or just in general to seek support. So that's the second important thing. Get involved. And lastly, my most important, like my most favorite way of establishing yourself as a mental health ally is checking in. Now, checking in can be as simple as sending across a text, sending across an email, a DM, or even a voice note, uh, letting the other person know that you are thinking about them, and reminding the person that you are there for them if they ever need you now or later. Now, checking in can be as simple as this. So, this was the message that I received like about a year ago, but it can be so powerful because this was the message that got me out of bed that day. Now, this was a time when I was going through a very difficult phase in my life. And on this particular day, I just couldn't get out of bed. I was avoiding food, I was avoiding socialization, and I just lay there doing nothing. And if you look at the time, this is sometime in the evening, and this message popped in into my phone, and I got out of bed. Now, it might be surprising for a lot of you because you might think that this is not offering any solutions. And you're right, it did not. And it did not make any of my problems go away. But I wasn't looking for solutions at that point. Uh, I was just looking for a hand to hold on to in case I started drowning. And she gave me that hand. And now I knew that if it got any worse, if the day got any worse, if anything happened, I knew there was this one person that I could reach out to, and she would be there. I knew that I wasn't doing this alone anymore, and I had someone to tag along on this journey. And that is how powerful checking in can be. And this is what most people usually need. They need someone to remind them that they are not alone, and they need someone to be there for them and listen to them. It's as simple as that, but super powerful. However, as simple as checking in can be, you can also go very wrong very quickly if you say or do certain things. So let's try to understand how do we check in the appropriate way. So while checking in, remember to ask open-ended questions and remember to reinforce the fact that you are not expecting any response from them. So instead of asking questions like, are you okay? Wherein the person would most often respond, we are all trained, or unknowingly we all are trained to respond, yeah, I'm fine. So instead of saying that, you can say something like, "You don't seem like yourself lately. Would you like to talk about it? I'll understand if you do not want to. I am here for you whenever you are ready." Now, this is such a powerful and such a great way to check in on someone, because if you say you are making the person know that you care for them because you can see that something seems to be off with them, you let the person know that it's okay even if you don't want to talk about it right now. So there's no pressure for the person to respond immediately. That already makes them feel calm, that, oh, someone knows that I need them, but I don't have to get back to them right away. And you also let them know that it's okay even if you're not doing it now, but you can do it later. That I am here for you whenever you are ready. So this one message can be powerful, can be comforting, and does make a great difference in the life of someone who is going through a mental health illness. So try using sentences like these. Or you can also say something like, "Hey there, you don't seem like yourself lately. Is there something at work, college that has been troubling you? Or is there any way that I can help?" Again, this is an open-ended question. You aren't pinpointing at something in particular that you've observed. You're just saying, "Is there anything at all that seems to be troubling you? Anything?" And that gives the person again the space to talk about whatever is on their mind. So again, another brilliant way to check in on, again, friend, colleague, neighbor, anybody. Another thing that you can do is, many a times, if you share your own personal struggles first, it makes the person feel a little more comfortable to open and speak about their own struggles. So again, you can start off by saying, "I know college can be hard. I have been struggling with physiology myself, or biochemistry, because I know how hard that can be. And I can't imagine what you might be going through. But I'm sure it must be difficult. Do you want to talk about it?" So sometimes this helps, that you are also highlighting uh, that you understand that it can be difficult. So you are validating their feelings as well. And then you are saying that, "Okay, I'm there. I could help out if you need anything. I'm here." So this is another great way to check in on someone. Another favorite of mine, and something that a lot of my friends do. This is something wherein you're not really offering help, you're not asking for anything. It's just that you are letting them know that we're there for you. So you can say, "Hey there, you don't need to respond at all. I was just thinking about you and I wanted to pop in to say hello." Now, many a times people with mental health, because they find it difficult to socialize, or they find it difficult to uh, get back to people or message, they sometimes might find it, they have this guilt, and they find it difficult to start a conversation as well sometimes. So if you, there's a possibility that they might want to get back with a friend after, let's say, a month or 2 months, and they haven't been able to speak to that friend because of uh, any reason. So if you send in a message like this, it opens up a space for them to talk. So they know that uh, even despite all of that time, the friend has been understanding of their situation, and the friend is still there. So again, another beautiful way to check in on someone. And you do simultaneously need to remember things that you shouldn't be saying when checking in. This can be a very damaging statement, saying that "I understand what you're going through." Unless you have a mental illness, I wouldn't recommend saying this to someone. The intentions can be absolutely pure and absolutely nice, but this can be really misunderstood. Also, even if you do have a mental health illness, it would be safe to steer clear of this situation, of this statement, because different people experience the same mental illness in different ways. So instead of saying something like this, you can always say, "I do not know what you're going through, but whatever it is, I would like to help. And is there any way that I can do that?" So try using this statement. So here your intentions also do come across, and the person also will feel a little more comfortable to open up. Another absolute don't is, do not try to invalidate the person's feeling. Again, this one might have good intentions, when you might be trying to uplift the person by saying, "You'll figure this out, you don't need help, you're not weak." And you are trying to motivate, but in a way, um, it might be a lot more counterproductive. So So you can try saying that I think it's brave that you recognize that you're struggling and that you're willing to seek help. It takes a lot of courage to do what you're doing. I am proud of you and I'm here if you need anything. This is again another super powerful statement. And the number of times that someone has said this to me, and the amount of care, joy, and strength that I have felt with this statement, I cannot describe. So, this is an excellent way to check in on someone by reminding them that what they're doing is not easy and it's brave of them to be going through it. So, do keep this one in mind. And lastly, try not to check in with help, with advice or suggestions or solutions. Many times the person just wants someone to be there. They just want to be heard. And they aren't really looking for solutions. Like even when I told you in my example with the day when I couldn't get out of bed, I didn't need any solution at that point. I just wanted someone to be there. However, sometimes you might find something that might be helpful. You might have heard someone having tried that before, or you might have again seen something in an article that you know is going to work for sure. And how you can introduce that to your friend is you can say, I heard this can be helpful or it has helped me in the past. Would you like to look into it together? Again, saying this is a good way because you're not pushing the solution onto them. You're giving them a choice if they want to try it out. You're also letting them know they don't have to try it out alone. You're there with them. So this can be a useful way to introduce some solution that you have found helpful in the past. So there you go. Checking in can be super powerful, super kind, and it's one of the most amazing things that you can do, or the most beautiful act that you can bestow upon someone. And it goes a long, long way. And amazingly, everything that I have shared in this section is something that I have learned from my caregivers. I've been blessed to have some of the most supportive people around me, and I learn from them every single day. And these are all the beautiful texts that they do send me, and something that you might find helpful, something that you might find useful to use for your own loved ones. So there you go. Just going to pause to have a sip of water. Okay. So now there is a possibility that you might be doing all of these things. You might be doing everything right. And despite that, there might be a person who you know is clearly struggling, is clearly going through a tough time, but cannot or will not accept help. And this is where I would like to introduce tip number 3, that you need to be patient. I know when something like this happens, it can be very frustrating, and it can be, you might feel a lot of anger, hopelessness, and it is very valid to feel all of these things. But at such times, you need to remember that that person is an individual, and there are limits to what you can do to help someone. The journey as a caregiver is something that needs patience, lots and lots and lots of patience, and just gentle perseverance. There might be times when you are ready to support someone, but they might not be ready to seek support yet. And that is completely okay. You cannot and you should not force someone to talk. You shouldn't force someone to open up. All you can do at this point is that remind them that you're there for them and continue to be patient. So that's my very, very important tip 3 for all you caregivers. Be patient. Tough one, very, very tough one, very difficult, but something that's going to help both you and your loved one. Be patient. Tip number 4, listen with empathy and validate. Now, a lot of times, why our loved ones are afraid to open up is because they're afraid of discrimination. They're afraid of judgment. They might have had experiences in the past wherein they have opened up and someone has just jumped in with a solution saying, oh, you know what, you can try this. Or someone must have said something like, oh no, just try to be positive, it's going to pass. And all of those things have retained somewhere in their head and have made them more isolated and has made it more difficult for them to open up. Now, this is actually a completely different topic, and I can speak on this for another hour of how to listen, how to communicate with someone with a mental health issue, what are the do's, what are the don'ts. I love talking about this, but just some quick pointers that might help us. Moving this aside, yeah. Okay, so yeah, just quick pointers which will help you when you're trying to listen to a loved one sharing their issues. So number one is listen without interrupting. Seems like a very simple advice, but super duper important. The person here is using their words. They might feel like you aren't interested in their story, and it might stop them or it might prevent them from sharing. Number two, listen without making it about you. Now, again, here your intentions might be really nice. You might, so for example, if the person is sharing their own struggle, you might want to share your part of the struggle, and you might do it in an attempt to show solidarity so they don't feel alone. They feel that you understand, and I know that is where you're coming from. However, this also can be counterproductive, especially at a point when the person is opening up to you about their problems. You can always share your own story at a later time when they are a little more stable to listen. But when they are talking, do not make it about yourself. Just listen. Listen without any assumptions. Listen without offering any solutions, like we've established. The person doesn't need solutions unless they specify that way that uh, could you help me with this, or I do need solutions for this. Unless they specify, do not offer any advice. Just be there. Be reflective by repeating what they have said. This is a very, very powerful advice. So often when I am talking to someone and they repeat what I have said, it just gives me a confidence that the person is listening to me and they also understand. So again, a very simple advice, but super, super powerful. Acknowledge that they are not defined by their illness. Now, doing this as many times as you can is good. It's never too much. So as long as you keep on acknowledging and you keep on validating their feelings, they're going to feel more safe and supported to open up to you. Lastly, and most important, don't show negative emotions like anger, pity, sadness, helplessness when listening. We as people, we as mental health warriors, we are always on the lookout for all these emotions. So when we're opening up to someone, number one, we already have this huge guilt that, because of our mental illness, we are not able to contribute in social activities. We aren't able to fulfill our role. And we already have that guilt that people are having to do a lot more to take care of us. So because of that, we're always hyper vigilant. We're always on the lookout for such emotions. So it is possible to feel them. It is very valid to feel sad when a loved one is going through something. You will feel anger that you are unable to help them. It's very, very valid to feel all of these things. But try not to show any of those emotions, because it's going to push your loved one far away and they're going to shut down even more. Okay, again, could be expressed to them at a later time in a better way, but not when they're opening up to you. Okay, so hopefully all these points help you to listen with empathy and kindness to whenever your loved one is opening up to you. Moving on to tip number 5, assist in any way possible. Assist in any way that you can. Now, living with a mental health issue can be very, very difficult. can make simple everyday tasks very, very difficult. They might feel like chores in a way. Getting out of bed is the biggest task that these people have to do in the morning. Taking a bath every day might seem impossible. It is at such times that the smallest acts of kindness can make the biggest difference. Offer to go and buy groceries for them once in a while. Offer to do some extra dishes, help with the cooking. Offer to drive them to work, to and from work. Offer that, and so on. Now, any small act of kindness would be really, really appreciated. Now, if you want to hear it from the horse's mouth, I will tell you a true story. So I and my partner have been in a long distance relationship, and we meet for 2 to 3 days every 2 years. So this time, when we were about to meet, coincidentally, I happened to have my therapy session scheduled at exactly the same time. Now, this was a session which this was an appointment which I got after a very long wait, and so I couldn't cancel it. But I was so stressed and so worried as to how do I go for that session, because the time spent in that therapy session, the time spent going to and from the therapy session is all the time that would be lost that I could actually spend with him. And I was a mess. I was very, very anxious. But this beautiful human being, he drove me to the therapy session. He sat there with me, like he sat there waiting for me for that entire hour, and he drove me back home. Now, in his words, it was a very simple, small thing, but it was a huge thing in my eyes. It made me feel so loved, so cared, and it uh, validated my emotions and my needs. I felt very, very valued in that moment. And so that is how important it is. Any small act of kindness, assist in any way possible, no matter how simple, no matter how small. Trust me, it is going to bring about a huge, huge difference for the person going through a mental health illness. So that is my super duper important tip number 5. Assist in any way that you can. Moving on to tip number 6, guide them to seek help. Now, this is also in line with the third query, if you remember, that we had in the beginning. The 3 queries as to how do we know that our loved one is going through mental health illness, what do we do to help, and when do we seek professional help. So this tip 6 kind of also tries to cover that query. So guiding them to seek help. Now, let's try to understand when to seek help, and then let's try to understand how do we seek help. Okay, so let's put it into 2 categories. The answer to the first question, when to seek help, is very simple: as soon as possible. So as soon as you start seeing changes in mood, changes in thinking, changes in behavior, as soon as you start seeing them, it is advisable, it is recommended that you go and seek professional help. Now, I struggled for many years before I found the right help and the right treatment. In my head, I always kept thinking, oh, this is a phase, it's going to pass. Maybe I need to try harder. And I kept pushing it forth. I'm going to give you a spoiler here that there is no rock bottom. The sea just keeps, or the ocean just keeps getting darker and darker as you keep sinking deeper and deeper. It just keeps getting worse if you do not acknowledge it and you do not take steps to make it better. Now, in my last talk, wherein I had spoken about it's okay to not be okay and how strongly I support that statement that it is okay to not be okay, I did mention that I also disagree with that statement, because it is not okay to not seek help. It is not okay to keep struggling this way. It is not okay to live with life altering depression and anxiety. I have had it and I have faced it during traveling. I have faced it when I have been in the middle of a fully packed OPD. I have experienced it on the most important days of my life. It is awful. And you do not deserve to feel that way. You do not deserve to struggle that way, especially when help is available. Now, okay, as physios, I gave this example last time as well. As physios, if we get someone who has undergone an amputation, okay, and they've come to us for treatment, anymore, and this is how it's going to be, deal with it. Instead, we give them a prosthesis, we give them assistive devices, we teach them how to use those devices, we teach them how they can live their lives the same way again, how they can lead fulfilling, successful lives again. So we don't let that amputation hold them back. It's the same with a mental health issue as well. You need to find the right help, you need to find the right treatment, and you will be able to lead your life as usual again. Happier lives, not the one wherein you're struggling. It is just a diagnosis. It doesn't define you. And that's why it's very, very important that you seek help. Now comes the most difficult question to answer in today's talk, and something that a lot of people have asked me. I always find it difficult to answer this, but I'm going to try my best. The question being, how do we motivate a loved one to seek therapy? And I say it's a difficult question to answer because this is a difficult conversation to carry forth with a loved one. The important thing that you need to remember is when you're going about this conversation, make sure that you go ahead with love, with empathy, with compassion, with respect for the person. Go ahead with curiosity, and most important, go ahead with patience. Very important. This is not an easy conversation to have, but I will share certain do's and don'ts that you can keep in mind and which might form like a guiding framework for you to go ahead with it. Okay. So, first and most important, don't make this about yourself. So, when we are trying to convince a loved one to seek help, okay, we might use sentences again which are coming from a place of good intention. We might say things like, it hurts me to see you like this, or you make me so worried. We might say things like that, which again, like I said, our intentions are good and we are actually trying to show our loved one that we care about them. But this might actually create a lot of shame and a lot of guilt for our loved ones. They might start believing that they are the reason for all of our negative emotions, that they are the reason for our pain. What they might start thinking now is that, oh, we need to stop sharing anymore with our loved ones. We need to stop sharing because this is causing them so much pain. We are causing them so much pain. And instead, they might isolate and distance themselves even more from you. So this is a very, very important thing to keep in mind, that when you're talking, be very mindful of your words. Your intentions might be good, but remember how it is going to translate for your loved ones. So don't make this about yourself. Very important. Point number 2, don't give an ultimatum. Okay, this is the worst way actually to proceed ahead. Again, your intentions might be good. You might be pushing your loved one to seek therapy, and by giving an ultimatum, you feel they might just do it. But even if they do end up doing it, this is a change in behavior that you have brought about by means of a threat, by means of a force. So, number one, it's not going to last for long. Second, it's again going to push your loved one away from you. Third, it again will make the loved one seem like you're making this about yourself. Because by giving an ultimatum, you say that I don't know which state you are in right now. I don't know what's going on with you, but your behavior is hurting me. And so I need you to go to therapy by this and this date. You need to do it. Absolutely not recommended as a method to go about. Do not give them an ultimatum. Instead, Instead, what you should be doing is you should be curious. Okay. Ask them, try to understand why is it that they do not want to go to therapy. Now, we need to understand, dear caregivers, that this is a very nerve-wracking experience for someone. Think about it that our loved ones found it so difficult to open up to us about their problems. Um, us being anyone, being family, being friends, being even neighbors who are strangers in a way. So they found it difficult to open up to known people. Now think about it this way, that they have to share their struggles, share their weaknesses, share their problems with a complete stranger. It is very valid for them to feel scared. And at this point, let's try to ask them what are the other things that are troubling them, or what do they find as roadblocks in this journey to reach or to seek help. Now, there could be multiple reasons. Someone might have financial constraints. Therapy is expensive. They might have that as an issue. Someone might say that there is a lack of time. They might have a lack of access to resources. Some people might want to go to therapy, but they are so exhausted and they're lacking so much energy that they do not have the strength to search for possible therapy options. So maybe that is the hindrance in reaching therapy. Or another very valid thing, they might be worried that therapy might not work out. Maybe they have tried so many things and they don't have the energy left to try out another thing. So that's why it's very important for us to ask questions so that we can know in which direction can we help. And accordingly, we can give possible solutions. So, for example, if they say that, they are too tired, they don't have the energy to look for a therapist, in that case, you can volunteer. You can ask them that will they be comfortable if we look for a therapist on their behalf? Very important, ask them before you do it. Because again, if you go ahead and do it yourself, you are snatching away their right to control. They are snatching away their right to choice. So firstly, ask them, will they be okay if you research for a therapist on their behalf and then you can both look into the options together? Will they be okay with that? Give them that as a suggestion. Another thing is, if they are scared, if they are worried the therapy is not going to work out, or they just don't want to try anything, you can give them an option. Try telling them that what if we go only for 4 sessions? Okay, what if we just try out for a month, and then after a month we reevaluate again and we see that do we really need therapy or do we, skip it off completely? It's not useful for us. So try giving them that option. Or even if that is not working, try giving them a suggestion that, okay, don't go for therapy, just go in for an evaluation, okay, for an assessment. So this is also something that therapists do, okay. They do allow you to just go in for one session, okay. You can speak to them, they will assess, and you can discuss your concerns with them as to will therapy really benefit me, what does therapy look like, and what does it include, how often do I have to come in. So it's basically a space wherein they're not committing to anything, okay. They are just going and getting a feel of it, like my therapist likes to call it. Someone is coming to get a feel of therapy. So let them do that, offer them that as an option. Often when you do this, when they're just going in for an evaluation, it gives them a lot more control over the situation, because they know that they don't have to go back again if they don't want to. So this is actually a good option and something that I have seen work. So you can try this off. And if nothing is working, you can also offer them the solution that if you want, I will come with you to therapy. Just like my partner took me the other day. You can offer to drive them to therapy. Okay, wait for them over there. Sometimes if people are comfortable, you can sit in with them in the therapy session. If the therapist, if the person, if you, everyone is comfortable, that is an option. So try to explore these options. Try to, instead of pushing them for therapy, try to understand why are they not looking at therapy. And these are just some of the options which I'm telling you. There could be multiple reasons for them not to. So try to understand all of that and then try to offer solutions. So be curious. The next important thing is do use affirmative language when you're speaking to them. Now, this is a difficult conversation anyway for you and them both. Try to repeatedly use sentences like, you are so loved, or remind them that you are in charge of your own story. So it again gives them the sense of control that they can make a decision here. You are just providing them with all the possible options that are available, and they are making the decision. Or you can, like we discussed earlier, you can say statements like, it is brave that you recognize that you are struggling with something and are willing to seek help. I am proud of you. So use sentences like these when you're talking to them. It's just going to make them more comfortable to voice out their concerns. Okay. And lastly, most importantly, don't push too hard. Okay. Like we already established, it's important that we respect their autonomy. Okay. We give them the space and time to think. So once you've had this entire conversation with them, once you've given them all the options, once you've discussed everything, after that, just give them their space. Just give them some time to think and then check in. So after you've given them some space, then you can obviously check in again to ask, oh, what have you thought about it? Do you want to talk about it again? Do you want to explore other options? But before you check in, do give them certain time. Like we established already, this is a journey which requires patience, which requires gentle perseverance. So give your loved ones that time and just be there for them once you've spoken to them. Okay. So hopefully these do's and don'ts give you some pointers, some guidance as to how you can initiate the talk of seeking professional help with your loved ones. My last and very, very again important tip for the day, with a wrong spelling in there, it's actually take care, sorry, is to take care of your own health, my lovely caregivers. You must have already heard of this analogy multiple times before from different people, that, wear your own oxygen mask before you put on the mask for other people. Very simple analogy, very logical, and very, very important to remember. Caregivers who take care of their own emotional and physical health, they are a lot more adept at dealing with setbacks, and they enjoy happier moments even better. So, very important that you look after your own self. Sleep well at night, eat well, maintain physical exercise for your own self. Sometimes getting a therapist for your own self can also be beneficial. Like I mentioned, you might also end up getting caregiver burnout or caregiver depression. So in such a situation, having your own therapist who will guide you along this journey might also be beneficial. And whenever you're taking care of yourself, whenever you're taking all of these steps to look after yourself, remember to do it without guilt. You deserve all of this. Like I said, you have been supporting a person with all your love, all your care, all your heart. You deserve to be taken care of as well. The breakup that I did speak about in the beginning, the reason that it happened was because it our story had become completely about me. It had all become about what is going on with Shivani, Shivani's struggles, Shivani's joy, um, Shivani's mental health, Shivani's good day, Shivani. It was all about Shivani. And he got lost somewhere in the process. He got burnt out. And when we looked back at it, that is when we did realize that these were the mistakes that we were making. So we started taking steps. We started ensuring that the needs and care of both are met. Okay. We ensured that he gets his own me days, wherein he can spend it without actually looking after me. Uh, we started ensuring that we spoke not only about Shivani, but we also spoke about him, his days, his needs, his care. And most importantly, we started ensuring that we spent time outside of his role as a caregiver, and we spent time as partners. Very important, not just in a romantic relationship, but also in other relationships. even as a mother and a daughter or a father and a daughter, um, basically a caregiver and a child, very important that you spend time outside of that role. You have fun just as two individuals. You have activities other than caregiving to look forward to. So we started doing that. And after making all of these changes, seeking the right help, finding the mistakes that we made and correcting them, I am happy to announce that I will be marrying that very person in Jan next year. So the whole point of sharing the story is that even though it might seem very dark at the moment, even though it might seem that you're completely lost, you don't know what to do, there are always ways. Okay. Don't do it alone. Don't go on this journey alone. Speak to people. Like, I am here if you want to speak to other people. Find support systems. Okay. Try to share responsibilities with each other, and you will surely find a way out of it. Okay. Uh, with the right guidance, with a lot of love, with a lot of patience, all of us, every single one of us can cook ourselves a very beautiful, lovely, happy ending. So that is what I wanted to focus on. And with that, I think we have come to the end of our talk. I would just want to briefly, quickly uh, announce, or not announce, just introduce Last Day Buzz One. I did talk about this in my last talk, but unfortunately, there were a couple of things which happened on the personal front, because of which this had to be kept aside, and the blog had to be shut down for a while. But happy to announce that we are all good to go and launch again. So this is one of my initiatives wherein I realized that there was a huge gap between caregivers and mental health warriors. There was a huge communication gap between neither was able to understand what was happening with the other. And so I decided to launch this platform. And we would be going live very soon, possibly in the next 2 weeks. And we hope to provide you all with such similar resources and ideas in the future as well. So that's me. If you have any queries, you can ask right now or whenever. I am always available, a text away. So yeah, I think that's all from my side today. I think that's all on my talk. Dr. Farid, if you have any queries or anything coming up, I would be happy to answer them now.
So thank you so much, Shivani. I don't think we have any queries at this point of time, but I'm quite sure many people are going to approach you post this.
Oh, absolutely, absolutely. I would love to. I always love talking on this topic. It's very close to my heart.
That's lovely. And thank you so much for being available for all of our students. So
Thank you so much for
a
having me.
big thank you to you. That was a very insightful talk, and I'm sure it will be able to help us all in its small little ways, small and big both. So I would like to take this opportunity to thank Manisha Sangvi ma'am, Parag Sancheti sir, and Apurva sir for providing this amazing opportunity to us via PhysioTV. And I would also like to thank the technical team of PhysioTV, and a special thanks for Amruta ma'am too. And this is Dr. Farheen signing off, and have a great Sunday, everyone.
Thank you. Bye-bye.